Hello, welcome. Thanks for joining us today, Lupus LA. We're going to give people a few minutes to come on in. And why don't you, if you've joined us, please tell us where you're joining us from. Hello, Culver City. We have LA in the house. Hello, hello. We are just so grateful to have Dr. Monica Blied with us here today to talk to us about strategies for navigating bias in the patient experience. So I'm gonna take myself off camera. I'll be in the background if you need, but I'll let you take it away.
Thank you so much, Maggie.
Thank you.
Thank you for Lupus to Lupus LA for having me today. I am Dr. Monica Blied. I am so sorry, Maggie. Can you unpin yourself, unspotlight yourself? Okay, I think if you turn off your video, it's going to do it now. Okay, awesome. Yay! Hi, I'm Dr. Monica Blied. I am a licensed clinical psychologist in Southern California. In my private practice, I see adults who are living with chronic illnesses and trauma, and I also provide assessments for autism, ADHD for adults and children as young as 8 years old. I am a part of the Lupus LA Medical Advisory Board and have been since 2020. And I'm also a lupus patient. I've been living with lupus since 2012. And that was actually my second year of grad school. So just like everything got shuffled up and turned around when I got my diagnosis and trying to get treatment after that. And so I come to you as a professional, and I'll be sharing some advice and strategies as a professional and as a psychologist who formerly trained medical providers, so physicians and nurse practitioners, and so on and so forth, in patient-centered care and strategies that would reduce and avoid bias. So I'm coming to you from that perspective, but then also coming to you from the perspective as a patient myself and as someone who has encountered bias in my own medical care. So I have two main points. One, why do we need this conversation? Navigating bias in healthcare. And the second is, what can you do as a patient? So number one, why do we need this conversation? So there was a very recent article published April 15th of this year. So last week, actually, in JAMA Internal Medicine Journal that talked about stigmatizing words that are in medical records increase medical error. So if you see me looking down, because I have notes, lots of notes. We got a lot to talk about today. And so I'm reading from my notes. And so there was research that was conducted. There were 2,300 patients across 29 hospitals where they scrubbed their records and looking for the presence of any stigmatizing language, including like difficult patients or this person like persevered on, whatever words that I said, or, just things that, introduce or give examples of that medical provider having bias, negative bias against that person. And so what the study found is that in files where there was stigmatizing language against the patient, that patient was twice as likely to have a diagnostic error, twice as likely to be misdiagnosed with something. And stigmatizing language was more likely to be present in the records of Black patients and also patients who had public insurance and patients who had complex comorbidities. And so I'm so grateful. This actually came in my email this weekend, and it was a Medscape article that was written by Dr. Perry Wilson, who is an associate professor of medicine and public health at Yale University. And so I'm so glad that he covered this particular journal article and research that was recently, very, very recently published, because what this study demonstrates is what we have lived as patients. And in fact, many of you may remember just last month, around March 20th of 2024, there was a social media influencer, African-American, Jessica Pettaway, 36 years old, who died from stage 3 cervical cancer after being misdiagnosed with fibroids. She had a lot of bleeding and other symptoms, and doctors dismissed her as, oh, you just have fibroids. Black women have fibroids. And it wasn't until the cancer had progressed so severe, and I'm not going to get into the details, but you can read the news. But it wasn't until it was stage 3 that she was finally diagnosed, got treatment, but unfortunately, it was too late, and that person passed away. And so I know people who have been misdiagnosed. Maybe you, as a lupus patient, was misdiagnosed for years before someone finally figured out that you had lupus. So we know that it is real. We know that it leads to negative outcomes, including getting treatment later, including worsening impact on our organs and other systems, failure, and sometimes even to death. So I don't need to belabor that point of why we need this conversation. Our lived experiences give evidence for it. This very recent research of over 2,300 patients having their medical records scrubbed give evidence for it. And now I'm going to get into, okay, so what do we do about it? How can we be empowered as patients to make sure that we are not the next statistic? Okay, so I have 5 points for what can you do as a patient. Number 1, check your charts. Okay, so you can actually, as a patient, ask to have see a copy of your medical record. And so with Kaiser system, it's super easy, apparently, because everything is electronic and you can see. But whatever medical system that you're a part of, or wherever you get your care, you can ask to get a copy of your medical record. And you can even ask to get a copy of the notes right after each appointment that you go to. And so what you're doing is you're looking in those records for any stigmatizing language, for any untruths, for anything that paints you in a bad picture. Like I had one of my therapy clients telling me that she went back and looked at her records, and it said like hostile patients, and she was just like, I have witnesses. Like, I was just asking questions. I was not like in any way like hostile or aggressive. I'm not sure where this came from, but it impacted how other providers treated her because they were seeing this language in her record. So ask to see them, and then you can ask to have portions of your medical record either redacted, meaning parts removed that are untrue or that paint you in a light that is stigmatizing, or have it revised. So that is your right as a patient. And then also document your request. Document that, like, on April 22nd at 12:12 p.m., I called, St. Mary's Hospital and asked for a copy of my record. And then I asked to have this language redacted or revised. Make sure that you're documenting along the way. Number 2, change your doctors. Just because you've been assigned a primary care physician or whatever specialist on your team does not mean that you have to stay with that person. keep in mind that you are paying for a service when you go in and you see your medical provider. You may not be paying it for directly out of your wallet, but you are when you're paying your insurance premiums. If you have private insurance, you are when you're paying your taxes. If you have Medi-Cal or Medicare or another public insurance, you're paying for that service. And so if you're being disregarded, if you're being not listened to, if you're being talked over and disrespected by that provider, you can ask to change your doctor. You can ask to see another provider. Okay. And if you cannot change your doctor, so maybe you are in a small town where, you have a heart condition and this is the only cardiologist for 100 miles or something like that. I have some strategies for what you can do if you cannot change your doctor. Ask the doctor to clarify or explain what they mean when they're sharing with you your lab results or your diagnosis or whatever the case might be, because sometimes the physicians and the medical team can kind of like talk over your heads or talk too quickly, because it's kind of just we get in a routine of how to explain things. But you can ask, like, okay, hold on, break it down for me. And we're not going to have this a 5-minute appointment. We're actually going to have it a 15-minute encounter, because that's what you're billing for anyway. And so I would like you to clarify, explain what you mean by that. Okay. Also ask for the differential diagnosis. And so if the doctor is saying that you are, your diagnosis is fibroids, for example. Okay, well, tell me your differential process. And what that means is, how did you determine that it's this diagnosis and not these other things that it could be based on my symptoms? Okay, so ask for a differential. And again, if they're talking over your head when they do that differential, say like, okay, hold on, slow down. Explain what you mean. Can you clarify that? Why did you rule out this, particular option and then rule in this? Okay. The next thing is to ask about the side effects for any medication that you're being prescribed. And this was something that negatively impacted me when I was prescribed a medication for migraines, and had a terrible, 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 impact. And then the doctor didn't call, even though I called them the next day and emailed and called them the next week and then called them the following week. It was actually another person who is involved with Lupus LA, Brianna Cardenas, and she was actually going to be on this particular webinar but couldn't make it today. She's a physician's assistant, and I called her and I said, hey, I'm having hallucinations. I'm like, all these things, and my headache never went away in the first place. And she was just like, and I can barely come up with my words, those kind of garbled, and the doctor is not calling me back. They are not responding. And so she was able to treat me. She was able to provide that care for me when the physician, for whatever reason, too busy or poor, medical staff supporting them, it just didn't happen. So, thank God, because who knows? And so many of us don't know what to do next when there's that non-responsiveness. And so one thing that could have benefited me in that case was to ask about the side effects of this particular medication and about the risk benefit analysis. And so, when a physician prescribes you something, they've kind of determined in their mind, that the benefits outweigh the risks. And so for me, for example, taking hydroxychloroquine or Plaquenil for my lupus, although it has a black box warning of causing permanent eye damage, the risk for that is quite low on the dosage that I'm on versus the benefit of actually controlling my lupus. And so I had that conversation, and how do I mitigate the risk then? How do I decrease the likelihood that my vision, would be impaired one day? I go to get my vision checked and my eyes dilated every 6 months versus most people go once a year. So you can ask about what are the risks, what are the benefits, risk benefit analysis, and then how can I mitigate or lower the risk? And so you notice that as I'm explaining this to you all, I'm using a lot of big words or like medical terminology. And there's someone that I follow on Instagram, Auntie Bev, Auntie Bev. And I love her because she teaches vocabulary. And so the benefit of using these words is you automatically garner more respect from that medical professional. And I wish it wasn't this way. I wish we didn't have to deal with respectability politics, which is like, if I show up or appear a certain way, then you'll treat me differently than if I showed up and appeared a different way. But unfortunately, that's how the world works, very, very sadly. And so, using some of these words can kind of benefit you, unfortunately. Okay. And then also, if you are asking for a specific medication or a specific course of treatment and that doctor is refusing, saying like, hey, actually, I think that, pregabalin might really help with my nerve pain because I had a bad response in the past to gabapentin, and like this nerve pain is really like interrupting my life. And they're like, no, pregabalin, this actually happened to my mother. No, pregabalin or Lyrica, it doesn't work for anybody. And, it's just, he said something, it was ridiculous. It was like, it's just, going to be a waste of time. So, what I recommend is this opiate medication. Unfortunately, it's like it would blow your mind when you hear some of these stories. And so if that is the case, and the doctor is still refusing a particular course of treatment or medication, ask for them to document in your chart that you asked for this course of treatment and they refused. Okay, again, documentation, documentation, documentation. Okay, ask. And then usually, and I've had this happen for a few of my clients when they came back, like, yeah, when I asked them to document that I asked and they refused, all of a sudden they were open to a conversation with me about the risk benefit and about, what is their, thinking process around this particular course of treatment. Okay, so that was number 2. Number 1, check your charts. Number 2, change your doctors. And if you can't, these other strategies. Number 3, set an agenda. And this is actually something that I used to teach physicians and medical staff when I was working as the health promotion and disease prevention program manager for the VA. I would teach them motivational interviewing and patient-centered care. When you go into an appointment, I understand, medical provider, I understand that you only have this amount of time, but you have this amount of things to get through. And therefore, it can seem very rushed. It can seem almost like they're just checking boxes because there is quite a bit of documentation that they have to get through. And so, compassion on their side for everything that is going into that appointment that they're trying to get done within that time. However, and then you have some, patients who just talk, because maybe it's the first appointment that they've had where someone was available to listen. However, physician, medical provider set an agenda, and you as a patient, you can set an agenda. You can kind of command your presence in that place for each appointment, and this is the script that you can use. I know we're here to discuss, fill in the blank, my labs. And I was hoping with our time, we could also review fill in the blanks, my medication and my pain level. And I brought a few questions for you. Where should we start? Notice the script. I know we're here to discuss X. I was also hoping that with our time today, we could review Y. And I brought a few questions for you. Where should we start? The where should we start place, we're using psychology. It kind of puts the ball back in the medical provider's court. So they still feel empowered and they don't feel, in any way like disempowered or, there's a lot of egos that can take place, just being, very honest. Not for everyone, but I think each of us has run into into situations where that was the case. So we're kind of stripping that ego away and, putting the ball back in their court. Okay, so I'm just going to say it one more time. I know we're here to discuss my labs. I was hoping with our time today, we could also review my medications and my pain level. And I brought a few questions for you. Where should we start? That gets into number 4. Write down your questions in your agenda. So just like I wrote down my 5-point, thesis for today, I had to scratch out some things, as you can see. I want you to write down and bring with you your agenda and your questions and prioritize your questions. If you're coming in and it's supposed to be a 15-minute appointment, but they normally only give you 5 or 6 minutes and you have 14, 15 questions, everyone's going to leave disappointed, okay, or frustrated or angry or upset. But say if you had 14, 15 questions, but you've prioritized, like, these are my top 3, no matter what, I need these answered, then we're kind of playing on the same team. And so you and that medical provider, you all are collaborating and you're partnering in your medical journey, rather than it being, this is the expert and you're the, person who's just receiving, okay? Because they are the expert in medicine or in whatever fields that they're practicing, and you are the expert on your life. And so you guys can come together and partner and collaborate for your medical care and for your medical best. Number 5, bring a friend with you and or a patient advocate. And there are companies that are staffed by physicians and, nurse practitioners and other medical providers where they show up as patient advocates. So maybe you don't have a friend or a family member who can come with you to appointments, because of whatever life situations, but maybe you have that patient advocate who can even come on FaceTime or on a video call. And I definitely recommend that over just a regular phone call, because a regular phone call, when you're bringing it into your appointment, it's easy to ignore. It's just kind of this voice that, doesn't have a person to it, but it's harder to ignore or dismiss when you're seeing an additional face in the room. And so I recommend bringing in a friend, bringing in that patient advocate on video if they're not able to come physically with you. And so having that person as a part of your care team is so important for so many reasons, but especially because when we're getting a diagnosis, we're getting medical news, or maybe it's a routine, visit with your rheumatologist, but you're getting a new medication, we're under stress. And so when you're under stress, we are less receptive to be able to hear everything that we need to. And so that other person can be that extra set of ears for you. They can help you to remember to ask that question or to follow up or to say, like, hold on, kind of clarify, explain what you mean. The other strategies that I gave you, they can kind of just be your wing person, if you will, to help you with those things. And then you'll also feel less alone. And if something happens where you are treated with stigma or bias, you have an additional witness there to kind of validate, like, hey, yeah, I saw that too. Like, yeah, that was disrespectful as well. Because in these situations, what happens sometimes is that it happens so quickly and so subtly that we're like, okay, wait, what just happened? And then we start to gaslight ourselves. And we're like, well, maybe it wasn't that bad. Maybe that's not what he meant, or, whatever the case. But when you have a second person there, they can be like, no, that was messed up. They did talk over you, or they weren't listening, or dismissed, or whatever. Having that additional set of ears and eyes can be really helpful. So I hope that all these strategies were really helpful. I'm going to review it one more time, numbers 1 through 5. But remember that, like, take a deep breath and re-own your power. You can do this by 1, checking your charts and asking to have portions redacted or revised and documenting your request to do so. Number 2, changing your doctors, especially if you're not being listened to or you're being disregarded anyway. You are paying for a service as a person who has insurance, whether it's public or private insurance. And if you cannot, ask your doctor to clarify, ask about side effects and the risk benefit analysis, ask for a differential diagnosis, and ask for any refusals of your request of a change in treatment plan or a change in medication, any refusals to be documented in your chart that you asked and they refused. Number 3, set an agenda for each appointment. I know we're here to discuss my labs. I was hoping that with our time today, we could also review my medications and pain level. I brought a few questions for you as well. Where should we start? Number 4, write down, because when you're under stress, you may not even remember all the things that you wanted to say and wanted to bring up. So write it down, your questions, and prioritize top 2, top 3, okay? Because it's still, within our medical system in the US, there's still, time constraints and restrictions that the medical providers actually have to adhere to. So having compassion about that as well. And also writing down your agenda. And number 5, bringing in with you a friend, a family member, or patient advocate, even if it's over phone, FaceTime, or video, so that you are not alone. Okay, that was a lot of talking. I would love to hear any comments and feedback about what I've said so far, and any questions. Brianna said, very helpful. Maggie said, I agreed. And then,
Yes.
yes.
Oh, thank you so much. We do have one in the chat if you'd like to start with that, or I'm happy to read it for you.
Yes. So in the Q&A, in the chat or in the Q&A?
Well, they're both. So you want to do the chat first?
Yeah, I'll do the Q&A first because that came
Oh, the
in
Q&A came up first. Okay, so
first.
we'll do the
Yeah.
Q&A first.
It says, if you have an experience like this in the ER or hospital, do you think it's worth it to notify someone else at the hospital that this is a concern if you're alone and don't have an advocate with you? Absolutely yes. Absolutely yes. And sometimes, depending on that hospital that you're at, like the VA hospital, for example, there are patient advocates that are there. And so you can ask to speak to them. Notifying someone else at the hospital, yes, just letting them know and then asking them to document in your chart that you have this concern. And then also you documenting it yourself. This, incident of bias happened to me. This was the doctor's name. This is who I reported it to, writing those things down just in case there's ever a time when that needs to come up again. We don't want to just rely on our memory. Someone said in the chat, asked, I recently requested my medical records from a doctor's office and they charged me $40. I thought I was entitled to my records. Apparently I'm entitled to it, but I have to pay. Yes. And so doctor's offices are entitled or are required to give you a copy of your medical records, but there is an expense for printing out things. And so oftentimes they will charge, normally it's a nominal charge like $10 or $5 or something. $40 is pretty steep. And so I imagine in that case, it might have been like a very thick medical record. And so there's a lot of printing and then like the admin time to actually do that. And so hopefully it's a situation in the future where your medical records are electronic and you can access them electronically. But there are still some medical offices where they're still using just paper files. And so in that case, you will have to pay.
I
Uh,
love I love what you said, Dr. Blight, about these strategies are so they're just simple and concise and really so important. And I would also guess that it could take a little practice, right? Because sometimes when we're not used to doing that in a doctor's office, it could be a little intimidating, like you say, and we feel like we don't want to question someone's authority or something like that. That, practicing could also be really helpful, I would imagine.
Yes, yes. Thank you for bringing that up because it is quite intimidating because it feels like a one down position,
Yeah.
with this person who knows everything. And then, like, I just know about me. But remember, we want to bring it to a one on one collaborative care model where it's a partnership. You're partnering with your medical team members for your medical best. And so, practicing with a family member, having things written down again, it's going to help a lot because when your mind goes blank, when you're under stress, there's actually a physiology to that. When we're under stress, what happens? And I have my little brain model here actually on my desk, but this is our frontal lobe, right? This is our thinking brain. This is our problem solving, our rational thought. This is our emotion regulation here in the front. This is where, like, hey, I really want to make sure that I follow up that question or that comment that they said with this particular thing, all happening here, right? But then here, deeper in the brain, is our amygdala and our hippocampus, and basically our fear center. This is in the temporal lobe. We call it temper, right here behind your ear. And when we're under stress, this is activated, even if you don't think you're stressed because like, oh, this is like not that bad and I'm not being treated hostilely or whatever, but feeling like you're in a one down position, that in itself is stressful. Or if you've ever had medical trauma in the past, the hippocampus, the brain remembers, and that is stressful. And so what studies have shown on MRI studies, there's actually less blood flow, cerebral blood flow to the frontal lobe when we're under stress, when this is activated. So you don't even have access to these parts of your brain that would help you with, okay, let me take one step at a time. Let me ask you to clarify and explain what you mean. So having it written down is super helpful. And also practicing in a non-stressful environment is helpful. And remembering to take deep breaths. And so a deep breath is not like most of us do when the physicians ask us to take a deep breath, but it's notice the difference. And, if I stand up, I got a cute dress on, so I'll go ahead and stand up. But I stand up, like the belly goes out with the inhale because that activates our diaphragm and our parasympathetic nervous system, our body's relaxation system. And then when you exhale, like you're blowing out a birthday candle, you're blowing leaves in the wind, slowly through pursed lips. A long exhale also activates that same system. It engages our vagus nerve. So there's a whole biophysiology that happens just with a simple breath, a simple deep breath that actually helps us to relax and helps to, innervate or reconnect the parts of our brain to help us in those situations. Take a deep breath. Someone asked if they could see me one-on-one. I'm actually not accepting new clients to my therapy practice. However, I know that Lupus LA, and Maggie, you can speak to this. You do have resources for patients, resources for if they want someone to talk to, or support groups, even if you're looking for a therapist or a coach or, medical mentor, team member. Lupus LA provides that. And so I'm just,
Definitely. Thank you. Yeah, thank you for mentioning that. Absolutely. I try to help our patients find something either within their own network
Mhm.
or something in the community. There are some that provide sliding scales and such. So please feel free to give me a call here at Lupus LA, and I will be happy to help do some research with you. Mhm.
Yes. And so one person asked, where can we find a patient advocate? Is that something that Lupus LA can help with? I also have contacts that I can share who actually accept Medicare insurance, which a lot of chronically ill individuals do have. But
That
Maggie,
would be great if you could send that over. I would love to have that resource. I think that would be great. And I've researched a few, but always love to keep that, list going.
give me just a second. I'm actually going to get it right now because as a person who lives with ADHD, if you don't do it right away, it's probably not going to happen. So, my colleague, her name is Dr. Nicole Rochester. She's at My GPS Doc. And I just put her email in the chat. And she also has, she might not have immediate availability. She's a physician who opened up her practice or her business of being a patient advocate after seeing what her dad went through and trying to get care for his needs and being minimized, dismissed, et cetera, as a Black man in the medical system, and said, if I wasn't a physician, my dad would be dead. I'm a physician, so I'm talking to the other physicians and helping to navigate his care. But how many people have a physician in the family who can speak their language, who can advocate and, say like, no, actually, have you thought about this? Or, what is your differential diagnosis? Or, actually, my father needs XYZ. And so her passion birthed her business. And she also gave me a couple other directories that she stands behind. And so I put those in the chat as well.
Thank you so much. I'm also going to put my name here with the number for Lupus LA to give me a call.
Mm-hmm. Yes, thank you. Judith
And
said, my
please,
doctor.
you can also find us on our website.
Yes.
Um, And there is one other, yeah, I think another question was about patient advocate because someone did mention that their
Mhm.
doctors had a very negative comment
Yes.
and just feeling really like she would need some help and wants to talk to someone. So please.
Yes. And
And
the beautiful thing about the patient advocate is that, like, they're usually medical providers, so they understand the medical system, and they will talk to you and kind of talk through some of those nerves and anxiety, talk through some of the medical trauma that you may have experienced, and then also show up for you at those visits, whether it be like a scheduled visit or you have to go to the ER. And showing up, meaning, they may be anywhere in the country, but they can still be on video and talk to your providers and ask the questions that maybe you don't know to ask or that you forget to ask because you're under stress. Someone asked, in addition to practicing, do you have any recommendations for when you get really anxious seeing a doctor again who has been dismissive before? Yeah, so taking those deep breaths, having the agenda written down, and asking, like, this is the agenda that I'd like to follow today. Where would you like to start? That's really important. And then also seeing if you can change doctors. If the doctor has been dismissive before, has, demonstrated bias or bigotry or anything, get somebody else, like find someone else, because usually it's not the only doctor who's able to see you, and think, outside of the box. And so when I went through my medical trauma after the birth of my last child, it was a doula who helped me. My friend sent me information for a doula who was kind of walking me through, and actually connected me with an OBGYN who was not even in my medical network, like didn't even accept my insurance, but that OB saved my life. And I'll give you guys a long story on a different day, not today, but he saved my life. And so sometimes you got to look outside of the obvious. I didn't think to call a doula for, postpartum, but she was actually the one who said, like, hey, ask them to give you a hysteroscopy. Ask them to check your blood for XYZ. And so the residents and the doctors were like, oh, that's a good idea, and like I said, I wouldn't be here today if it wasn't for that. So naturopath doctors, DOs, doctors of osteopathy, they usually have a holistic approach that they go to when they're treating their patients. Those sorts of resources could be, people that you start to see if you're having really bad experiences with the people that you're with right now. Okay, any other questions?
Not that
And
I am
back.
seeing. Hello again. Um, I think we got to all the ones in the Q&A and I believe in the chat.
Mhm.
Really just such meaningful and important information. Thank you so much
You're
for
very welcome.
joining us today, Dr. Blight. It's always wonderful to see you.
Oh, thank you. I'm so grateful for the Lupus LA community, and how much you all have helped my life. Back in the day, before I became Dr. Blied, like I was a recipient of the what is it, the $500 grant, the
Emergency
emergency
grants?
grant? Yes, yes, I was the recipient, and it made such a, like, it was a huge deal for me because I could not afford at that time what I needed, which was tents on my car.
Mhm.
And so I was able to get the clear UV tent on my front windshield and on the front sides of my car. I'm gonna cry. And so it's just, it, like, as a patient who like eventually like became doctor and could help other people, it just is so important, the work that Lupus LA is doing. And so I will come in and do a webinar or workshop anytime because I believe in it. It's made an impact in my life, and I know that it is saving the lives of so many lupus warriors around the world.
Thank you. Thank you for sharing that. Appreciate that. Okay. Well, I'm going to do one final little scan. Just a lot of thank yous, of course. And I'm going to thank everyone for joining us today. And thank you again. And I'm wishing everyone a wonderful rest of your day.
Hey, have a wonderful week, everyone.
Hey, bye-bye.